I'm Elspeth. I'm a consultant paediatrician with an interest in paediatric allergy, and I've been asked to talk to you this week about allergies in children. So we've had a few questions about food allergies and allergies in general. So somebody has asked us, what is the likelihood of my second child or baby having a similar allergy like my first? And then it says cow's milk protein allergy. So there is an increased risk in families of having an allergy in the second child, but it's not a direct link. The advice almost always is to just go ahead and feed your second baby with those foods and see how they respond. There can occasionally be reasons why we would suggest not, and talk to your health visitor about that. Your health visitor or your GP should also be able to signpost you. There's a brilliant advice sheet for families who are going on to have second and subsequent babies after a first has had allergies, and that comes from our national body, which is called the BSACI, and that gives a little bit of advice on how to do it and what to look for. The next question asks, how reliable are RAST tests? So RAST is a slightly old-fashioned term, and we tend to use a term now called specific IgE tests. They're blood tests, and what they're looking for is antibodies, something called IgE, to particular allergens, either pollen or in the main we use them for food. They are reliable and I do trust them, but they are never useful by themselves. What we need to look at is the history, so to hear what has the child reacted to, what was the reaction like, when did the reaction happen, how long after eating the food. We also then think about the child in general. Do they have eczema? Do they have asthma? And could that be influencing those results? So they're useful and reliable, but only ever as a whole, as part of a jigsaw. So what treatment is available over the counter to treat hay fever in children? And one of the first things I'd say is you can't avoid these allergens. They're there, they're in the air, but there are things you can do to help. So for example, if it's a high pollen count, don't hang the bedding out to dry on the washing line, dry it inside. And on days with high pollen counts, often we say change your child when they get home and just move bath times. So have a shower or bath when they get in and change into clean clothes. Lots of people find wearing sunglasses really helpful if they have bad eye symptoms. And there are lots and lots of other antihistamines which don't sedate, and talk to your pharmacist about that and they'll advise on the right one for your child's age.